Hypoglycemia and hypotension are two conditions that can significantly impact bodily functions, but they affect different systems in the body. Hypoglycemia is characterized by abnormally low blood sugar levels, leading to symptoms such as dizziness, sweating, confusion, and in severe cases, loss of consciousness. On the other hand, hypotension or low blood pressure can cause dizziness as well, but is more likely to be accompanied by fainting, blurred vision, and fatigue. Treatment for hypoglycemia typically involves quick administration of sugar, while managing hypotension may include increased salt intake, hydration, or medication, depending on its cause. Major risk factors for hypoglycemia include diabetes management medications, while for hypotension, risk factors range from prolonged bed rest to certain heart conditions. Here's a deep dive into the detailed aspects of each disease, shedding light on their unique implications for health. Symptom onset, sudden versus gradual. Hypoglycemia, characterized by an abnormally low blood glucose level, typically presents with a sudden onset of symptoms such as sweating, trembling, a feeling of hunger, irritability, and confusion. In severe cases, it can lead to loss of consciousness or seizures. The acute nature of hypoglycemic episodes often requires immediate intervention to restore blood glucose to a safe level, typically by consuming fast-acting carbohydrates. In contrast, hypotension or low blood pressure may emerge more gradually and can sometimes be a chronic condition. Symptoms can include dizziness, fainting, blurred vision, nausea, fatigue, and lack of concentration. While acute drops in blood pressure can occur and cause sudden symptoms, like in orthostatic hypotension, the overall development and recognition of chronic hypotension as a condition might evolve over a longer period. Management typically focuses on underlying causes and may involve increased fluid and salt intake or medication in more severe cases. Primary cause: low glucose versus low blood pressure. Hypoglycemia and hypotension, while both can manifest in dizziness and fainting, have disparate primary causes and implications. Hypoglycemia points to deficient blood glucose levels critical for cellular energy, notably impacting brain function, which is heavily reliant on glucose. Without timely intervention, it can lead to serious neurological deficits and even coma. In contrast, hypotension signifies low blood pressure, hindering adequate organ perfusion. Chronic hypotension can result in organ damage due to insufficient blood flow. Acute cases, such as in shock, are life-threatening emergencies requiring immediate medical attention to restore blood circulation and prevent organ failure. Distinguishing between the two is vital for effective treatment, as their management strategies differ considerably. Affected systems: metabolic versus cardiovascular. Hypoglycemia primarily disrupts the metabolic system, particularly glucose utilization, leading to a deficiency in the main energy source for the body's cells, especially the brain. Symptoms can include shakiness, sweating, confusion, and in severe cases, loss of consciousness. It often requires immediate intake of sugar to prevent further complications. Conversely, hypotension affects the cardiovascular system, resulting in inadequate blood flow and oxygen to organs due to low blood pressure. Symptoms may manifest as dizziness, fainting, and blurred vision. Chronic cases of hypotension might warrant treatment with medications or lifestyle adjustments to ensure organ functionality and systemic balance. Differentiating between the two is crucial, as both can present with overlapping symptoms such as dizziness and cognitive changes, but the underlying causes and treatments differ significantly. Common manifestations: trembling versus dizziness. Hypoglycemia and hypotension, two distinct conditions, can present with overlapping symptoms, leading to diagnostic dilemmas. While hypoglycemia, characterized by low blood sugar levels, often manifests as trembling or shaking due to the body's response to a lack of glucose, hypotension, or low blood pressure, may cause dizziness and faintness as the brain experiences a reduced blood flow. Distinguishing between them is crucial since they have different root causes and treatments. Monitoring blood glucose and pressure levels helps in identifying the underlying issue, with immediate action ranging from consuming sugar for hypoglycemia to lying down to improve circulation in hypotension. Typical triggers: skipped meals versus dehydration. Hypoglycemia, or low blood sugar, often results from skipped meals, excess insulin, or a disproportionate intake of carbohydrates relative to physical activity. Your body, deprived of glucose, signals distress through shakiness, sweating, and confusion. Conversely, hypotension, low blood pressure, can be precipitated by dehydration. When your fluid intake is insufficient, blood volume decreases, leading to dizziness, fainting, and blurred vision as blood fails to adequately circulate. While both conditions share symptoms like dizziness and weakness, their triggers are distinct. Hypoglycemia is closely linked to dietary patterns, whereas hypotension is more aligned with overall fluid balance and cardiovascular function. Understanding these unique triggers is key to proper diagnosis and treatment.